Knee replacements are one of the most successful and commonly performed orthopedic surgeries in the world, and they're only becoming more popular. But what exactly is a knee replacement? For some people, it's a term that calls to mind images of bionic joints and robotic body parts, but in reality, knee replacements are actually much simpler than that. By the end of this video, you'll understand not only what a knee replacement is, but what it looks like, what it's made of, the basics of how it's performed, and even who may benefit the most from this surgery. Hi, I'm Dr. Bounajem, and I'm a board-certified orthopedic surgeon. After residency, I completed fellowship training at Harvard Medical School specifically for hip and knee replacements. As someone who's spent thousands of hours talking with patients about knee problems and performing knee replacements, I've run into a lot of common questions about what exactly knee replacements are. Over the next few minutes, I'm going to share that exact knowledge with you. For starters, even just the name knee replacement can be kind of confusing. When we say knee replacement, we're usually talking about a total knee replacement as opposed to a partial knee replacement, and that's something that I'll talk about in a future video. The name knee replacements is also a bit vague because when most people talk about the knee, they're referring to the whole knee, a structure that includes bone, cartilage, tendons, nerves, blood vessels, and other soft tissues, when in reality, not all of these structures are replaced with a knee replacement. The technical medical term for knee replacement is actually more specific about what is replaced, and that term is total knee arthroplasty. Arthroplasty literally translates to joint and molding or restoration. This is fitting because knee replacements really only replace the joint part of the knee, not the whole knee. The knee joint is made up of 3 bones that move on one another: the femur, the tibia, and the patella, which are the same 3 bones that are typically treated in a knee replacement. By far, the most common reason that people get a knee replacement is because of osteoarthritis. Osteoarthritis is a degenerative disease that leads to loss of cartilage from the joint. And this is a big problem because cartilage performs many important functions in a healthy joint, like helping distribute our body weight evenly across the joint surface and helping reduce friction between the bones that move on one another. As the cartilage wears out, it literally disappears from the joint, and as a result, the bones get closer and closer together until they can potentially start rubbing on each other. This leads to high levels of stress in the joint, causing inflammation and pain. Here's an example of an X-ray of a knee with severe osteoarthritis. Cartilage is not visible on X-rays, but you can see the space that it occupies between the bones. In this case, you can see that there is very little space between the bones, which tells us that the cartilage has almost entirely been lost. You can also see osteophytes, which are commonly called bone spurs, and these often accompany the loss of cartilage and contribute to pain and inflammation. Since the root of the problem of osteoarthritis is the lack of cartilage and the bone that's rubbing together as a result, the ultimate treatment for arthritis would need to remove the damaged bone and cartilage while keeping as much healthy bone as possible. And that is exactly where knee replacements come in. During a knee replacement, a high-speed power saw is used to remove all the damaged cartilage and bone. The meniscus in each side of the knee is also removed as part of the surgery, which is great because any meniscus tears that may have been causing issues before the surgery are no longer issues after the surgery. This model shows a knee after the damaged bone and cartilage have been removed. We are left with clean, flat surfaces of bone. Since the bottom part of the femur is a rounded structure, multiple cuts are used to fully remove the arthritis here. In contrast, a single cut is performed at the top of the tibia bone to remove the arthritis there. The patella, or kneecap, which sits in front of the femur, often also contains arthritis. Some surgeons choose to remove the arthritic surface of the patella as well, while other surgeons leave the patella in its entirety. Once the bone has been fully prepared, implants that match the size of each patient's anatomy are attached to the bone, either with or without cement. The implant placed at the top of the tibia is called the tibial component, and the implant placed at the bottom of the femur is called the femoral component. If the surgeon decides to remove the rear surface of the patella, then a patellar component is implanted in its place. Most contemporary knee replacements are made out of metal alloys, and the term alloy just refers to the fact that multiple metal elements are used to form the materials, as opposed to just a single metal element. Cobalt, chromium, and titanium alloys are commonly used. You can sort of think of the metal implants as what replaces the bone part of the knee joint, but what replaces the cartilage? In order to create cushion for the metal to move on, we use durable plastic called highly cross-linked polyethylene and insert it between the metal implants. This attaches to the tibial implant and provides a smooth, durable surface for the metal of the femoral component to move on. During movement, the patella glides in front of the femoral component, and this is why the front of the femoral component has a groove that mimics the anatomy of a normal femur. You may have noticed the bands on the sides of the implant, and these represent the ligaments around the knee joint. The one on the inner side of the knee is called the medial collateral ligament, and the one on the outer side of the knee is called the lateral collateral ligament. These are important structures that provide stability for the knee joint, and they basically prevent the knee from moving too much side to side. During a knee replacement, we sometimes have to partially release or loosen one of these ligaments if it's tighter than the one on the other side, but oftentimes we just leave them alone. The other two primary ligaments of the knee are the anterior cruciate ligament, or ACL, and posterior cruciate ligament, or PCL. The ACL is not needed for most modern knee replacement designs, and since it's often torn due to the arthritis that prompted the surgery in the first place, we typically remove any remaining fibers of the ACL that are still present. On the other hand, the PCL may either be left alone or removed by your surgeon depending on the implant design that they choose. One question I commonly get is how I get into the knee joint in the first place and what I do with the patella or kneecap in the process. After making an incision on the front of the knee, I make a deeper incision in the soft tissues beside the patella to then slide the patella out of the way and access the knee joint. This deep incision beside the patella is known as an arthrotomy. I don't remove the patella to access the knee joint because keeping it attached to the tendons above and below it is very important in order to keep the knee functioning well. I can then begin the process of removing the arthritis and preparing the bones for the implants. Once the knee replacement has been completed, I repair the arthrotomy with suture so the patella is returned to its original position. As you can see, knee replacements replace the worn out bone, cartilage, and menisci of the knee joint, but importantly, it doesn't remove many of the other crucial components of a healthy knee, like the muscles, tendons, nerves, and blood vessels that are around the knee joint. An important consequence of this is that any pain coming from these remaining structures, like pain from tendinitis or pain from nerve dysfunction, would actually not be expected to improve after a knee replacement. That being said, because knee replacements remove all the arthritis and meniscus tears of the knee, patients who have pain specifically because of advanced arthritis in the knee joint are the ideal candidates for surgery, and they stand to gain the most improvement in pain and function after knee replacement. Let's finish with an X-ray of a knee replacement. You can see that the metal implants have taken the place of the damaged bone and are functioning as the new surfaces of the femur and tibia. It looks like there isn't anything between them, but that's actually where the durable plastic insert is, which is just invisible on X-ray. You can see that unlike the earlier X-ray where the femur and tibia bones are almost touching, the plastic is now creating a nice even gap between the femur and tibia, providing a cushion for the new surfaces of the joint. That wraps things up for our primer on knee replacements. There's of course a lot more information to know about knee replacements, like how long they last for and what the recovery is like, and I plan to cover these topics in future videos. In the meantime, if you think you might need a knee replacement and you're interested in knowing how to find out, I'll be posting a video on that very topic, and when I do, I'll link it on this screen. If you found this to be helpful, leave me a comment down below on what I should cover next. Stay well, and I'll see you in the next video.